SFM Telangana welcomes you into this informative webinar, which is going to be convened by Dr. Shagun Agarwal, our secretary, and a geneticist par excellence, a professor in the Nizam Institute of Medical Sciences, Hyderabad. I hand over the session to Dr. Shagun. Please give us an introduction of what you're going to take us through this evening, and then the MOCs will take over.
Thank you, Dr. Chinmay. So last meeting, all of you have seen how to draw basic pedigrees and what are the different pedigree symbols. So today it's like a deep dive into pedigree. So what we are trying to see today is that why do you want to draw a pedigree as a fetal medicine practitioner? Because many people feel that it's very time consuming and then it takes away, precious whatever what the time limited time what you have, and does it really add to your practice is the question in everybody's minds. It's good to know the theory, but today the purpose of today's session is to see how it's practically applicable. So why do you need to do it, how do you actually go about it, and what difference does it make to the specific clinical scenarios which we have collected today. So before we go on to that case-based kind of a situation where we are actually going to have some live pedigree drawing done by Dr. Rupa Darshini, and you're going to see how it's going to change the whole case once the pedigree is there on the screen. So before that, we'll have a recap, and Dr. Priya is going to take us through some easy softwares which many of you who are using the hospital systems are doing the work online and all. So easily these softwares can be integrated and help you in making the pedigree in a really fast and simple manner. So I think so that's the purpose for today's session. Yeah. So
thank you, Dr. Shagun. And we acknowledge the presence of our seniors here, our mentor emeritus, Professor Ashok Khurana, our president of SFM, Dr. Mohit Shah, past president, Dr. Bimal Sahani, and incoming Dr. Sunil Mehta. So in the presence of all these seniors, we have this young masters of ceremony today. Dr. Sahiti Reddy, who's also the Joint Secretary of SFM Telangana, and Dr. Rachamala Madhuri, who is a very young member of the SFM Telangana. So I will hand it over to the MOCs now to take the program forward.
Thank you, Dr. Chinmay ma'am. I'm Dr. Madhuri. Good evening, everyone. Respected to all the seniors. Experts of today's session is Dr. Khurana sir, Dr. Mohit Shah sir, and Dr. Bimal Sahani sir. And Dr. Ashok Khurana sir is most eminent personality of fetal medicine, and his mentor emeritus of Society of Fetal Medicine, editor-in-chief of Journal of Fetal Medicine, and sir is a past president of Society of Fetal Medicine, former ISWAG ambassador in India, and sir is a former dean of Indian College of Medical Ultrasound. And Dr. Mohit Shah sir, and he's a consultant diagnostic and interventional sonologist. He's a national president at Society of Fetal Medicine, national president at Musculoskeletal Ultrasound Society, and sir is a vice president of Indian Federation of Ultrasound in Medicine and Biology. And Dr. Bimal Sahani sir, is a director of Sonoscan Center at Aurangabad, India. Sir is the immediate past president of Society of Fetal Medicine, deputy editor of Journal of Fetal Medicine, and faculty of various national and international conferences. Sir is a co-author of second trimester guidelines of Society of Fetal Medicine. Now I hand it over to Dr. Sahiti ma'am for further.
So we welcome all our expert speakers here. So our first, I would like to introduce Dr. B. Sandhya Rani, who is a well-known obstetrician who is working currently at Warangal at Lakshmi Narasimha Hospital. Dr. B. Sandhya Rani is HOD for DNB Institute at Lakshmi Narasimha Hospital. Ma'am is a chief consultant at Lakshmi Narasimha Hospital and a director of Ekashila Hospitals. Ma'am has been the past General Secretary of WOGS, IMS practitioner. Ma'am is member of various societies such as ISOPUB, ISAR, ISECG, and ICOG. She has many publications in national and international journals. Ma'am has conducted many conferences and CMEs at her place, Warangal. Ma'am has participated as a speaker in national and international conferences. We welcome you, ma'am, for today's evening. chairperson is Dr. Amita Inder Sen. Ma'am is the head of the Department of Fetal Medicine in Apollo Cradle Hospital in Jubilee Hills and Kandapur. Ma'am has done Masters in Obstetrics and Gynecology from Madras Medical College. Following her post-graduation, she did fellowship in Advanced Obstetrics and Gynecological Ultrasound in 2010. Further, 2 years postdoctoral fellowship in fetal medicine was done. She has presented many papers in national and international conferences, has then been faculty in many programs. Her special interests are fetal cardiology and multiple pregnancies. Now I hand over the session to both our chairpersons to take it forward. I request Dr. Sandhya Rani ma'am to introduce our speaker, Dr. Priya ma'am.
Thank you, Dr. Sahiti. Thank you for giving me this opportunity. And Dr. Priya, welcome. She is a consultant at medical geneticist, and she did her DNB super specialty in medical genetics from NIMS Hyderabad, MS in obstetric gynecology from Mysore Medical College, and MBBS from Bangalore Medical College and Research Institute. And she had over 5 years of experience in field of genetics, and her specialization in diagnosis, genetic counseling, and management of various genetic disorders, expertise in reproductive genetics, pediatrics, neurogenetics, immunogenetics. And she's a member of Society of Indian Academy of Medical Genetics, and executive member of Special Interest Group for Prenatal Medicine and Society of Fetal Medicine. And her passion is increasing awareness about genetic disorders, contributing to genomic research, and formulating guidelines for genetic testing and management in reproductive genomics tailored to the Indian population. Thank you, madam. Please go ahead.
Hi, thank you so much for that wonderful introduction. It's a privilege for me to be a part amongst this esteemed institute, and I thank the Fetal Medicine Organization for giving me this opportunity to present cases. I hope my slides are visible. My
Yes,
slides are
ma'am.
visible. Yeah.
Yes,
Without
ma'am.
much
Go ahead.
further ado, I'll be taking you through manual and software assisted pedigree drawing. I know we had a talk about pedigree drawing in general. So here we'll look at obstetric specific scenarios where we can use pedigree, and it will be very useful in our obstetric practice. And I'll show you some tricks where we can use, because all of us are using hospital management system now. So it'll be very useful for us to do this online. It hardly take 2 minutes to draw any kind of pedigree, and then you can put it as a part of your regular practice from now on. So the plan is to do a quick recap, do some pedigree symbols which are specific to obstetric, do a software assisted pedigree drawing. I'll give you 3 particular softwares which are there, and I'll show you which is the one which is easiest. And then we do some quizzes if we have time for, and then a conclusion. So this is something we've already known the history, where the pedigree comes from. It looks like the crane foot. I thought it'd be wonderful to put that, diagrams showing the crane foot and how they imagine pedigree through it. The importance, as Dr. Shagun was telling us before this, is to understand or identify certain inherited disorders which would otherwise go unrecognized if we don't draw pedigree in our regular practice, to recognize them as which pattern of inheritance do they really belong to detect carriers so we can kind of cater testings for them and try and understand where the disease is coming from. And also, it's a wonderful tool for family screening. Okay, so the pedigree should generally be recorded in longhand, family history form, and family tree. We do a medical practice of pedigree. So this basic symbols of pedigree has come from the Pedigree Symbol Society. So these are already dealt with. The basic symbols are already dealt with. So I just go into those which are important in the obstetric or reproductive genetics field. So you have the diamond symbol, which detects the pregnancy. And then you have those for affected, unaffected, abortions, ECTs, that is ectopic pregnancies and others, which can be symbolized like this. I'm just going to give you a visual capture so you remember how to draw, because this will be very helpful when we go further to do the drawings as such. The lines, you would already know the relationship, sib line, line of descent, and others. The twins and fertility, you have monozygotic with a connecting line between them. The dizygotic, the unknown can be put as a question mark, and then the trizygotic without the lines in between. If we don't know the parentage, that can also be depicted in the pedigree as a question mark. And this is for those where tubal or tubectomy or vasectomy has been done. This is to very specifically for infertility, where you look at azoospermia or endometriosis or anything else. We could show the two double lights and also mention the cause, or if we know about why the infertility is there. And this is for adoption, where you say adopted in with a dotted line, and adopted out, you show which is covering the with a bracket around it, and also show if the relationship is available where they're adopted out. Now, these are very specific for sperm donors and ovum donors. I want you to look at them because this is something we'll use again. So if we have a sperm donor, we detect it with a capital D and then join it to the pregnancy. And then if we have an ovum donor, a capital D with a circle, and then that joins the pregnancy. Also, we have surrogate only, where you show the pregnant couple and then the surrogates depicting that the surrogate has come from also a part of this pregnancy, and also the gametes have come from the parents themselves. So you have surrogate ovum donor, where you have mention of the surrogacy also, and the donor is also put into the picture. And then you have planned adoption, where the sperms and eggs are coming from the donors themselves, but the parents are shown in the dotted line. So these are very important, and all these symbols are also available in online pedigree drawing. But we can also use them in our manual pedigree drawing. So these are other genetic evaluation symbols. I think you would have already gone through them. Now, whenever we start drawing pedigree, we try to see the proband first, put whoever, like the marriage and then the children first, and then go from eldest to youngest child. So there are certain things that we need to remember when we're going through pedigree. So start with the proband or the consultant, identify 3-generation family around them. I'll show you in a progressive way how you can identify them. And some 4 simple techniques for consanguinity can also be followed. Okay, so coming to those parts, and then you always have to remember to add the finishing touches, where you put in the generations. That's the first arrow. Then mention the key, and also mention the numbers for individuals so they can be easily identified. And also, you can also put in the carrier's symbol. Now, here there's a little bit of a controversy whenever you have a carrier testing or a carrier that you need to depict, because most Western software use this dot as a symbol for showing carriers. That is what is available in most of the softwares, and many people also use it in their clinical practice. But in general, the symbol for autosomal recessive carrier status should be half shaded on the left side, and for balanced chromosomal translocation, half shade on the right side. Coming to manual pedigree drawing, so identify your patient first and draw the husband, draw the children, then go up, find the parents, so father, mother, go down, add the brother, sister, whoever else is there, find their spouse, add their children. Okay, then go to the mother's side, identify the grandparents, and if you have any significant member from there, the aunt, uncle, so on can be added, and their family can also be incorporated. Now look at next the relatives of the father, and you can add the father's side of parentage also. Then coming back to the husband's side, you can see the partner's father, mother, then go for their sibs, then you can go for their relatives on the future. So these are the stepwise. Never forget to add in the end who is it taken by, who is it drawn by, where's the information, who's this pedigree is about, the age, date, and so on. So these are very important initial parts of the pedigree that we should also do. Now coming quickly, because I have only 15 minutes, so we'll do these pedigree drawings, software-based pedigree drawings. Now, the more important pedigree drawings that we know about, okay. So is the first one was the progeny. So this is a free online pedigree tool. So you just put progeny free pedigree because they have a paid version also, and you'll get this and stay begin pedigree. Okay, then you start with a pedigree builder. You can also say draw pedigree. Now it gives you a place to put the name. So you can say Mrs. Y or something like that, the name of the patient. And then it asks you to identify the gender. So you can say male, sorry, Mrs. Y, so female, and go next. And then it gives you an option to enter how many brothers, sister they have. So it comes with a detailed plan or a pedigree. So you understand. So for this, you should have previously taken or understood how many daughters, or you can ask these particular questions when the patient is sitting in front of you. Okay, so there you go, and you get the pedigree here. Okay, so as simple as that. Now, once you have done this, then you can do modifications in individuals. So here you can say, I want to add a relation. I want to add the husband or the spouse here. So I'm adding the spouse. See, the spouse got added there. Then I want to indicate that one of her child is having some disease, condition A. So apply symbols and say the child is having ventricular. Okay, so that can be then incorporated. You have to apply the check mark, only then it will incorporate. And see, there it comes. So at the end of it, you can build it around like this and say save image, and it goes up and gives you a pedigree symbol. Now this is good, but it has certain limitations. One is it shows each of these conditions like this. This is a very difficult way to kind of depict it. So it's not very convincing. The second one is to put abortions, ectopics. There are not many symbols. So these were not designed towards obstetric practice. So there is a little lack in showing those in the practice. Consanguinity, again, is a bit difficult to depict in this way, where you can draw the consanguinity, especially second degree consanguinity, very difficult to depict by the software. So then you have the others. So the next one I'm going to go through. Sorry, let me wait till it moves out. I I hope I can drag it somewhere else. Yeah. Yeah. So let me do this. So I'm doing a pedigree chart. So this is VP online. So visual paradigm online. You can just say that and say draw pedigree. This is how it kind of opens up. I have opened it up already for the sake of convenience. Now this is a paid software after a couple of times. So be sure that you kind of know that you are within 1 month is free. After that, it's not. Some parts of it is still free, so you can still use it. So that's the idea behind it. And once you can also kind of subscribe to it and log in or enter an account where you can save your pedigrees. After this, say make a pedigree chart. Okay, it takes a while. So this is how it kind of opens up. So here you manually kind of drag and drop images. So you do a husband and a wife, sorry. And then you say, I want to search a symbol of a line, and it opens up those symbols, and then you can use a line with it. So you can show the consanguinity here. So this is how you start going around and building the pedigree. The problems with software is it's a little time consuming. It's equal to drawing, dot by dot, which we do, on a paper. It's very accurate, but again, the problems of doing it for so long on the platform is a little time consuming. But of course, we can use it when we need to depict a special case. We can use it in our presentations. It's a wonderful tool to use it for all of those. And the third is InVite. This is one of the easiest and most the best tool right now that is convenient to be used even at the clinic setting. So I just start any pedigree with it directly. So you have a login that you have to do. It's a registration which is completely free. And once you have logged in, it's free to use for however long you want to use it. And I've been using it for 6 months without any issue. Once you have done that, you say start new pedigree and you start entering the patient's name. For example, Mrs. Q. Okay. So we have female and then go down. And I'll show you case-based scenarios also, but just showing you how we do it. So it just opens up something very basic where we have our program and we have the 3-generation sketch around us. Now we can start adding it. So all we have to do is click on that particular patient, and then either you can add partners, siblings, children, and so on. So I'm first going to add a partner. Then I'm going to add her children. So I'm saying she had one girl child, and then she had an abortion. So here you can see the annotations for abortions are also available. So I'm so sorry, you have to click it here to show the abortion, but I'll show you some other way. So you can do a sibling, and you have a chance to convert this into abortion or female or pregnancy or anything else. So this particular symbol is selected, go to the symbol, and then show that it's probably a termination of pregnancy for some reason. You can add another sib where you had so you can highlight there and say this was probably a pregnancy that they still carry. And you can even include features about the fertility, where you can say the fertilization is normal, it's with IVF, it's with ICSI, and so on, which also gets depicted right there. Okay, and also then you can add features within that. So this is by add field logo. So go say add field, and then you can say they had probably again ventriculomegaly, and say add condition. It will ask you a chance to choose between carrier or affected. You can say affected and say done, and it chooses it. Now you can add multiple features, whatever it is, ventriculomegaly, arthrogryposis, add condition, and say affected and done. So it goes on to build a pedigree like that. Now I will show, and also stores all your lists. Okay, now I'll show you with case discussion how this pedigree can help us in our day-to-day practice. First, let's see this Mrs. H. So I created this a little while ago. So I didn't show you the features. So you can also edit any of these previously drawn pedigree. Suppose you don't have time and you want to kind of come back to it, all that is kind of possible whenever you want to do it. So your pedigree lists are always saved. That's, I think, one of the blessings for me, because sometimes I don't have the time. So here I have added a donor. Can you see that? So she's Mrs. H, and and she's married to person Y, and they have a pregnancy right now from the donor. Okay, so donor X have been used. So if I click on that, can you see here? You have a chance to add the donors here, surrogate donor, ovum donor, and so on. So that's how I've added this particular symbol. And then you see she has 2 male siblings who are affected with intellectual disability in ASD. So I have gone ahead to add the fields here and then build the software around them. And I've also figured out that the grandmother, her mother's mother also had this brother who had intellectual disability. So all this gives us a clue towards where this is happening. It's the males who are getting affected, and it's there in quite a few generations. I should have added the age also. The age of onset was a little earlier in a successive generation. So the pedigree is giving me a clue that it's probably, X-linked disorder. So I'm thinking it could be Fragile X based on the symptoms that are shown. So this now gives us help to get to case 1. So this is the case 1. So based on this pedigree, we can understand who should be tested first. So here, the first test should always be done on the proband. That's the brothers of Mrs. H. Which test will you do for Fragile X? It's the triplet repeat TPPCR. So that's what we'll be asking them to do. And if it's negative, then further genetic testing. And what will be the recurrence risk for this present pregnancy in Mrs. H? So if Fragile X has been proved and she's used an oocyte donor, so the recurrent risk is going to be absolutely nothing, isn't it? So that's how a pedigree helps us understand a case and make it very simple. We'll do case 2, and this is a case of Mrs. A. So I'll take another 5 minutes. That's about it. So go to pedigree list, and I think I have Mrs. A loaded. So this is the one. Okay, so in this particular case, what we have is, sorry. Okay, so here you have a patient where, just let me just show you the entire pedigree. Okay, so this is the pedigree. So here you have a patient, Mrs. A. She herself has cataract, weakness, and palpitation. See there, I have put in the age of onset for each condition. That's very easy. So here you always have this chance. I told you once you come to this condition and you're saying affected carrier status, you also have an option to write which age the diagnosis has been made and so on. You can say onset, you can say diagnosis type, which could be molecular or non-molecular or clinical or so on and so forth. So all that can be added as a part of it. So you can see that she has those features. Her mother had features of diabetes and cataract, and then her her father had features of diabetes and cataract, and her grandmother had features of weakness. Now she's pregnant and she's come to you with an antenatal scan showing arthrogryposis. Now you can see that the relative age with which it is getting affected is going down, isn't it? So you have 65 years, then it's getting affected early around 60 years, then much earlier at 20, 30 years, and now in the pregnancy period also. So this phenomena is called, I think this is not, we cannot question and answer. So I'll give you a chance. This is an anticipation. So here we're probably looking at any guesses. I don't think I can. Okay, so this is a myotonic dystrophy. So it's a triplet repeat disorder. So it's affecting a CTG trinucleotide repeat. So there we have our diagnosis. So what could the diagnosis be? It's a myotonic dystrophy. What's the inheritance? It's a triplet repeat disorder, autosomal dominant. And what will be the confirmatory test here? Again, TPPCR is what we will do here. Okay, now here we have a case 3. It's for Mrs. P. Okay. Mrs. P. Okay. So here we have Mrs. P's history. So I've drawn this already. So you can take time to draw it. I just thought for the purpose of time, I'll just keep it drawn so that it's easily understandable. So here you have Mrs. P who has some adenoma sebaceous. Then you have a brother who's having intellectual disability, a mother who's having Chagrin patch, and a grandparent who's having seizures. So we have our diagnosis. This could be tuberous sclerosis, and that's very evident once you put the pedigree, isn't it? So here in the case 3, we have, case 3, we have, what's this phenomena called? This phenomena is called the phenomena of variable expressivity. The recurrence risk is 50%. This is autosomal dominant disorder. And again, the test of choice is tuberous sclerosis. So you would do an exome. If it's negative, you'd also want to do an MLPA because TSC1 and 2 can have deletions. So that's something you could talk to a geneticist before giving the test. And this is very simple. I won't go back to it. So here you see, you can draw consanguinity. Oh, I wanted to show you how to show consanguinity. So consanguinity, this is Mrs. Nina. So M, I think. Let's get it. So we have baby of Mrs. M here. Okay, I just want to show you how to put in consanguinity in this case. So you had X and Y who are like this. So let me just quickly draw this pedigree as a new pedigree. So I mean, it'll be easy for me to show you. So it took a little while. So here you have a partner, and then you have a pregnancy in case. I'm just making that up. So you can literally see how quick it is that if you know your way around, you can always do that. So you have a sibling, he has a sibling, maybe here, and then his parents just added on here. So that's about it. Now I want to show how to do a second degree, third degree consanguinity. So click on whatever degree you're thinking about. So if it's a second degree consanguinity, think of this. So here, in second degree consanguinity, the husband, and generally the husband is the brother or sister of the mother. So here we go and we say this particular symbol and say this or this. Sorry, I think I have to delete this. Just a second. So you have husband and you add this particular symbol for a sibling and show this. And there you have your consanguinity charted out for you. So all that, and you can rearrange wherever you want to rearrange it. And you can see the family is the second degree consanguinity. So these are easy to draw in this particular way as such. So that's a very good software to do everything else. So here they had hepatosplenomegaly and anemia, no prizes for guessing. We see the symbol of consanguinity, second degree consanguinous. So these are very evident, easy discussions when we look at the pedigree. There are certain limitations when we use the online pedigree drawing. For example, we cannot shade this particular pedigree. So we cannot shade any abortions or high drops or termination of pregnancy. So that's one drawback of it. The second drawback most of the time is the carrier status. Generally, I told you we have to make it half and shade it. That cannot be done. It will come as a dot only. That's with most of the pedigree software. So those are the two limitations which are there for this online pedigree drawing. Quickly going quiz. So we have this as a vertical pattern of pattern where multiple generations are affected. Males and females are equally affected. Male to male transmission is there, and transmission of individuals in both the sexes is seen, and every affected child has an affected parent. So this is an autosomal dominant disorder. Now here you are seeing this particular case. So I think there's a horizontal pattern of inheritance, single generation is affected. Males and females are equally affected. Children have an obligate carrier. The carrier status is shown in the parents there. So this is an autosomal recessive. So here you have males are more often affected than females. You have affected male passing it to all of their daughters, none to their sons, and affected males in the family are related to each other through carriers. So this is what we see as a night move pattern. The carrier is here depicted by a dot. So this is an X-linked recessive disorder. And here, this is very difficult because this is difficult to differentiate between AD and X-linked dominant. That's the most trickiest and most difficult. Others are fairly simple. So this is, you see, for rare conditions, females are about 2 times more affected. Now, this is what is the key to diagnose it. Affected males pass this to all their daughters who will not be affected and none to their sons. So it never shows a male to male transmission. See here, the male is affected, no male to male. Male is affected, no male to male. And again, male is affected, no male to male transmissions. Sons and daughters of the affected females have 50% chance. So this is X-linked dominant. Thank you so much for patiently listening to me. I hope I've done justice to understanding this pedigree in a deep dive and for using the online tools. And I think in the next sessions, it will be detailedly discussed. Thank you, ma'am. Thank you so much for giving me this opportunity.
Thank you, Dr. Priya Ranganathan, for a very excellent and elaborative lecture. on understanding pedigree chart. Ma'am, for every case, we have to draw pedigree chart even in regular obstetric practice or infertility practice, or only those cases where recurrent abortions or any bad obstetric cases, or consanguineous or non-consanguineous also. Can you elaborate?
So it's tricky, isn't it, ma'am? So the idea is the pedigree gives you a clue to which case you have to be alert and which case you think there is nothing going on. So unless you draw that pedigree, the differentiation of whether to draw for this case or not never comes. We prefer to draw it for all cases. It's a beautiful representation. It really takes, and I honestly mean it, it really takes only 2 minutes to draw with all these softwares now available, because I literally sit in front of my patients and do it within 2 minutes. It takes you a while to get a hang of it, but once you're getting a hang of it, it's very simple. So I would recommend for all of them.
Yes,
And
thank you, madam.
I think we have so much of consanguinity in our population, and now there are a lot of people coming and talking to us regarding the consanguineous marriages. So in those cases, I think it is imperative that we do the pedigree charting, because some of these things only show up when you go back, work backwards 2 or 3 generations, then the pattern becomes evident.
Yes, madam.
So
I think that was really a nice presentation by Dr. Priya, and thank you for making the audience aware of these softwares, because very many times, drawing elaborate pedigrees is very tedious. So those of you who want to do high-end work, see, the last time we introduced you to the pedigree, the symbols, and anybody who wants to do basic stuff, drawing circles, squares, and diamonds and connecting them with lines, you start that way. Once you reach a point where you think, now I can do better and I want more elaborate pedigrees and I want to show off my pedigrees, then probably you can go and use those softwares. So thanks for making us aware. So are there any comments from our experts, Mohit Shah sir?
Yeah, I love the way she's patiently and elaborately described the drawings there. And I believe that though I'm sure there's a learning curve there, but it would look much neater than hand-drawn pedigree chart. And eventually, I think it will also remove the ambiguity of a person's drawing. It looks neat for sure. And even if you probably make an error, you can just undo that and selectively rebuild that symbol again, rather than scrapping the whole chart and making it all over again. But very nice to look at, I'm sure.
And it would be good to send for publications also and give as a handout to patients.
Right.
So
Yeah, it looks quite neat, quite good.
there are some questions in chat box. Dr. Priya, can you tell the name of the software again? The various softwares, and I think the last one was the easiest probably.
Yes, I was just typing it out, ma'am. So Progeny is the one which came up with it first. So Progeny is good. And then you have Visual Paradigm, and then you have Invite. So these three are very good and very basic. And they are Invite is catered specific to the obstetric needs. So I prefer using it. But there are also other softwares which can be used. There's an EduDraw, something like that. So that also is a good one. But I mean, everybody finds a way, whichever is the best software for them. I think they start using it eventually.
I think if there's no more questions, we'll probably start with the trade videos before we move to the
Yes.
Q&A discussions. Vishal, can you ask for the trade videos to be started?
Sure, sir. Sure.